It's Mari McInerney from Croaky here at the Advanced Pharmacy Australia's annual conference here in Adelaide, and I have office holders, presenters at the end of the conference. Would you be able to introduce yourselves, Kristin and Kate?
Hi Mari, I'm Kristin Michaels. I'm the Chief Executive at Advanced Pharmacy Australia.
And I'm Kate O'Hara. I'm the Vice President of Advanced Pharmacy Australia.
And you have presented a lot, which could explain
I've
a little
worn my
huskiness.
voice out talking. I'm so sorry.
Then you know you've done a complete conference act. Yeah. The two of you co-presented on a sustainability workshop. There's been a lot of talk about sustainability here in terms of the venue as well. Can you talk about what you wanted to present to that workshop, and also what's driving your work?
Sure, I might talk a little bit about the organisation and then let Kate croak her way through some of the detail. So look, for us as an organisation, sustainability is incredibly important. As for all of us, we're working towards net zero. That's important for us as a society, as well as, as a small s society, as well as us as an organisation. We have a new strategic plan that will be launched next year, and sustainability will be one of the 5 pillars of that strategic plan. So we are certainly investing in that space and really keen to see change made at the practice level. To Kate, maybe to talk about the workshop.
Yeah, look, this is something our members are all doing currently. They're all very keen on it, and people are doing all sorts of really interesting things. So one of the primary aims of our workshop was to bring people together to share their ideas and work together and take the things that have been successes in other departments and amplify those in their own. So taking away those successes and getting them done across the country.
Are you finding with sustainability issues within health settings that it's grassroots up, or are we seeing both? Is it top down as well? Are we seeing systemic change?
I think we're seeing both at the moment. I think it's a really key area for most health services. Every state and territory in Australia has set a net zero target. But what we see from our members is that some of that's not filtering right down to the floor. So approaching it from both sides definitely can't hurt.
Were there examples you gave that gave people inspiration?
Look, there were. Kate was an absolute champion of some things that were maybe a little bit disturbing. She's definitely the yogurt police at her hospital. There's going to be no more of those not used yogurts in the fridge. That was a bit of a funny one, but you also had some amazing, less yogurty examples.
Yeah, I'm the staff room fridge police about food wastage at my workplace, and my staff are always really impressed by that. But there's been some really big changes done at statewide levels about reducing greenhouse gas emissions from anaesthetic gases by changing state formularies and working together where there's no clinical advantage, using the drug that's greener, and providing the regulations and the support for pharmacists on the floor to recommend those changes. There's been some really interesting work about turning off unused computers, really simple things, but will make a big difference.
But there's also, I'm interested in what areas too that you're looking at, because it's not just throwing out too much plastic, is it? It's also to the pollution from pharmaceuticals. What's your big view on it?
That's a really good point. So Advanced Pharmacy Australia is actually the only pharmacy and also the only membership organisation who's a member of the Monash University Transition to Sustainable Health Systems Alliance. So we're working there on a range of things, but it really does cross, as you've just said, so many parts. So think about procurement, along with waste, along with gases, medicines themselves. You might like to talk a little bit more, Kate, about that specifically, but absolutely medicines and the supply chain that actually brings medicines to us are enormous footprint.
So there's kind of 2 ways we can approach this. There's the advocacy piece to get the government regulations changed in the supply chain and in the procurement space. And then there's the individual piece where we're all doing what we can to recycle and change and just change our practice to be more sustainable.
And can you say what regulations or legislation you would like to see changed or introduced, and is it going to happen under the climate and health strategy?
Wow, that's a big question. We would like to see more transparency around the carbon costs of different medications. I think that's one of the easiest things, and it's something that people can use to action change, because then it's a known, not an unknown known, that we know there's a carbon cost to medications, but we just don't know what it is, and we can't compare medications. And if we're comparing like to like clinically, there's still a benefit to society if they're not like for like from a carbon cost perspective, and that will help influence our decisions. Some of the other work we can do is getting updated national guidelines that include some of that decision making. If there is no clinical difference, this choice is greener, consider using this, and changing our process in that way.
And on an international level, we're seeing some very big changes at the moment. COP's happening right now as the Trump administration begins appointing new people. How much has to be driven for you in your work from global efforts?
It's an interesting question. I mean, I think, look, obviously we're working towards net zero. We can't do that as a single country. That absolutely has to be a global effort, and it is. It is in a large way. Us, I guess, having won the Australian Government's agreement, climate and health is incredible. It's really great that we're moving there. That said, there's obviously still a significant amount more we need to do to actually achieve those targets. So is that just us? No, it's not. It's global.
Takeaway messages for your audiences here today and also the broader public health sector.
I think one of the most interesting things I've learned in this journey is that the most sustainable health service is one that keeps people well, and then deprescribing is a key thing that we do as an organisation and as individuals in our practice, and that's why we're really excited that sustainability is going to be one of the key themes of Deprescribing Action Week, to help reduce the number of medicines people are using, to help contribute to that sustainability piece, but also to improve the patient experience as well. So being able to do both those things together is really important for all of us.
Fantastic. Any final words, Kristin?
That was beautiful. You couldn't write more than that, could you?
That was very good. Thank you both very much.